The global pandemic triggered by the coronavirus is affecting us all. But the situation is much worse in countries of the global south, like in Africa, where the most deprived and disadvantaged members of the society are the worst affected. Children, girls, and women, especially in rural areas, with no access to social services, no access to technology for distance learning, with little possibility to practice social distance at home or in their community, and some of them even exposed to domestic abuse. Across the world, the number of schools which have closed and the number of children deprived from their basic right to education to go to school are staggering. The United Nations estimate that this year, the human development may even go down as a consequence of this global phenomenon. This is something not observed since 1990. And we know very well that education plays a key role in human development for the progress of the countries. We at Link Community Development International are doing our best to respond to the education challenges posed by this crisis in the countries where we work. And we would like to give you an update of what we are doing and what we plan to do over the next weeks and months. What we are going to see is what we are doing in the countries where we work. This is our response. Thank you.
Given that schools were closed and government discouraged travel for non-essential purposes, we have been unable to finish term 2 of the 2019-2020 academic year. We were remaining with the 2 weeks, so we had to close the schools early. The team project being affected due to those closures, we have been re-strategizing our operations to help manage the COVID-19 and also to respond to it. Key to that, we have prioritized the safeguarding. We have also continued to run radio programs that have been tailor-made for our learners within the COVID-19 program. And any cases reported from that, we've been able to work with the government to respond and provide the necessary support for any safeguarding. Other than safeguarding, we have also been in touch with our learners who want to hear from them directly. So these phone calls are helping us to know and understand what each learner is going through on a day-to-day basis during this period and provide any support that we can offer. We have also been supporting them to mitigate the impact of COVID-19 through household support, in this case providing food rations to the communities. And this is helping them to keep engaged and motivated and enrolled within the CPE center. We are working really strong with the parents, partners, and the community to minimize only child marriage and early pregnancies within this period when learners are at home. We know it's a challenging moment. Most of them might feel uncertain about the future, but we want to bring confirmation to them that the program is continuing, and we will open centers once the ministry provides that guidance, and the learning will continue.
The COVID lockdown greatly affected us because then we wouldn't undertake our activities, majorly meeting with communities, school communities, to assess the performance in schools. That has been affected greatly. In Uganda currently, we had to identify areas in which they would support the government interventions as in responding to the COVID-19 pandemic, especially its impact on learning and education. So as members of the Education Development Partners, we joined the consortium that was focusing on developing learning materials. What we want to appreciate is that much as the government agreed to produce learning materials, they were generally not adequate for all learners. And secondly, government also supported their learning on radios and TV, delivering lessons on radio and TV. However, we also realized that in those communities of Bulisa, Chukube, and Hoima, there are specific communities that do not have access to TV and radio, and of course, there are rural communities. So we know that there are learners who are not able to access either the self-study materials or the radios, and that it's at that point that we thought and worked with the districts to identify those specific learners who have not been reached the self-study materials. And our focus has been specifically for the candidate class, which is primary 7. So we've been able to print up to 2,000 packs of the self-study materials, and we've started distributing that to the learners who are the hard to reach areas within those districts. Specifically, we are talking of learners at the lakeshore regions or areas in that district.
There are a number of activities that has been stopped because of these restrictions and because of this COVID-19. For example, the tutorial class is stopped because there's no schooling this time. Teachers training is also stopped because gathering are not allowed this time. Only the activity which has been implemented this time is the construction activities. Actually, the construction is also reduced a number of staff. Almost half of the staff has been reduced because of the social distancing. So they are working with a limited staff. Otherwise, most of the activities has been stopped almost. This time we have prepared COVID-19 response plan, which has been approved by the fund manager and the donor. So we are working on passing messages to the community as well as our beneficiary girls through radio and through television. And also we are working on the rapid assessment on the beneficiary girls with the objective of knowing girls' awareness on COVID-19 and also identifying alternative measures or means of education delivery modalities, which will help us to replanning based on rapid assessment. And also in this rapid assessment, we are also working together with the zonal education department. So they are also looking for the outputs or the result of this study so that we will know what is the awareness level of the beneficiary girls. So we are working together.